We're going to make a start, everyone, because we've got to stop at 1:15, so we've got 35 minutes to have this patient access session. First, before we start, I'd just like to tell you a little bit about each of the panel members, and we'll do the same format as yesterday. I'll ask each of the panel members to talk for about 5 minutes about their experiences, and then if we've got time, then we'll go to the floor for some questions. So I'm starting from this end first, and sitting next to me I've got Lindsay Carter and Lene Carter. In 2014, so I've had the pleasure of knowing both Lene and Lindsay since 2014 when I started my journey in the medicinal cannabis space. And at that time in Parliament there was still a discussion about how to regulate medicinal cannabis, not only in Australia but also in the state of Queensland where Lene and Lindsay reside. And because of the difficulties in obtaining medicinal cannabis, Lene went public with her story. Lindsay had his first violent seizure at the age of 14. He experiences focal seizures, which temporarily arrest his ability to speak or comprehend. He also has a brain tumour. Lindsay and Lene have done an awful lot to promote medicinal cannabis use in Australia, and they are one of our pioneering strong advocates, and I thank them for the job that they've done in this sector along with many other people. There is still an issue around medicinal cannabis supply from their perspective, and on that basis I'd like Lene to talk to you about her experience. Lene, thank you.
Thanks, Teresa. So this is my son, Lindsay. Lindsay actually has a left temporal lobe brain tumour, as Teresa mentioned, and intractable epilepsy, which includes tonic-clonic seizures as well as focal seizures. And he travelled to the US in 2014 and to obtain medical advice. And in that time, he was recommended medical cannabis. There was a bit of a scary moment over there where they thought his brain tumour was growing. It actually wasn't in hindsight, but that triggered a doctor to send him to Washington State and recommended that he start on medical cannabis. And at that point, Lindsay started on medical cannabis oil and also vaporised cannabis, and had quite good results from it. So after an initial 4 trips to the USA and back, we came back to Australia and things weren't really where they needed to be. We actually had to start a few legal processes where his doctor put in an application for Category B under the Special Access Scheme. There was a lot of delays in access, so eventually Lindsay was approved. He had the first approval for Schedule 9 medical cannabis. It's no longer Schedule 9, but here in Australia. It was a very long, drawn-out process in the beginning. I think it was about 19 months from memory, from application to dispensing. Things have progressively got better over the time, but there are still a lot of issues. In 2018, we actually had to, after continual supply issues, and interrupted supply. So to give you an idea, out of 7 different suppliers, there was interruptions to 6 of those suppliers, and one that was quite consistent. So in 2018, we had to negotiate with the Canadian government and bring medicine back for Lindsay on 2 occasions in that year. And at this point, he is actually receiving medicine from an Australian licensed supplier. There is still an issue with affordability of oils, particularly for Lindsay, because he actually needs quite a high dose of oil. So we're still waiting. It's hard to believe that 6 years on, or I've lost track, all these years on, that we're actually still waiting for an affordable oil supply for Lindsay from in the Australian market. It's a very, very difficult thing. And for someone like Lindsay, if he runs out of medicine for a day, which actually this week he just one day without vaporising cannabis, he actually had 2 tonic-clonic seizures the next day, post-seizure vomiting, and until he could actually vaporise, he couldn't stop the vomiting. So, yeah, it's quite a hard road. It still is a hard road, but it's getting better. So it's basically our story in a nutshell.
Thank you, Lene. And thank you for that story. And we will have some time for questions so the audience can raise some questions of each of the panellists. The next panellist is Wei Fui. Wei is a stage 3B colorectal cancer survivor. He was diagnosed with cancer in 2019, and at one stage he was taking up to 80 pills a day to manage his cancer symptoms. And it was during this time that a friend suggested that he might try CBD oil. And there's a whole conversation we've been having around the use of cannabis products for not just the management of symptoms, but whether they may even treat cancers or even arrest cancer growth. So I'll let Wei take you through his story from here. Wei.
Hey guys, good afternoon. My name is Wei. I'm a stage 3B colorectal cancer survivor, as a lovely lady said. And I was diagnosed back in 2019. And it was one of those situations where my family and I had to adjust to like the new norm for life. And during that time, I was on a lot of pain medication just to try and help out with the breakthrough pain that was coming through with the cancer. It was definitely had to change up the way we were living in that regard. And what can I say? The amount of pain medication that I was on was very extreme, and it got to the point where I was continuously just in a cloud with the amount of opiates that I was on. So we managed to find a friend that was able to recommend the CBD oil, and during that time it went from 80 endones a week to 0, and it was amazing in the sense of the CBD oil really helped. So being here today is a bit of a testament for me, because I haven't really scratched the surface in regards to the whole breakdown. Having that gentleman that was on stage earlier, seeing the whole scientific breakdown of the cannabinoids has really like opened up my eyes, and I just want to be able to be a part of this whole community to see where it will lead me, just to be able to help somebody in that sense. I'm very fortunate now that I'm not on any opiates, and the CBD oil that I was on was amazing. To this day, like I've still got it. I'm probably running at about say 85% compared to how I was pre-cancer, but it's been 2.5 years cancer-free, touch wood, and looking forward to and just looking forward to continuing on this journey. So yeah, thanks for your time, guys. Yeah.
Thank you, Wei. And you know, you hear stories like that and you cannot do anything other than be a part of this community. That's the whole reason I'm still here after many years of battling the system. But when you hear stories like that, you know that we need to all continue. The issues that Lene raised around affordability are still a live issue. There's a few high-level issues on the table that we need to address, and that's why we all need to be a part of that journey. So my third speaker, and I apologise for my voice, I've clearly been talking too much for the last 24 hours and my voice has decided it doesn't want me to talk anymore. Zana Tuma is a fellow of the Royal Australian College of General Practitioners, and she's practiced quite broadly. So she's going to talk a bit about medicinal cannabis from a prescriber's point of view. She is a prescriber of medicinal cannabis, and she's passionate about providing access to this treatment for those that are living with chronic pain and anxiety, and where she has seen quite some benefit for her patients. She's interested in the mind-body connection, the emerging field of psychoneuroimmunology and its application to managing stress-related conditions. Zaina.
So that was my bio that I wrote a year ago for Double Base. I wasn't aware that you had access to that, which needed to be updated. So anyway, so I just want to briefly share 3 population groups that I feel have difficulty to access. So I'll share just 3 case studies. I'm a GP VMO in emergency in Western New South Wales. So I'll share an experience I had in Forbes. So when you're out there, you're the sole doctor and you're managing either the emergency department or the wards. And I just remember a patient, I won't give you his name, but he had quite a severe stroke and was basically, so I was flying out over a period of a year and I would see him on the ward, like slowly make progress. And one of the main issues was he had a very severe melancholic depression, which was not responding to SSRIs, and he just wanted to die. And he didn't want to engage in rehab, and he was just like, I'd do a ward round every day, and he was just like, I want to die, I don't want to get out of bed. And I guess in my naivety, rushing between running the ED and the wards, I spoke to him briefly about medicinal cannabis. And I wasn't an authorised prescriber at the time, but I remember coming back after my shift and putting in a SASB application for him, getting it approved, trying to speak to the pharmacy before I had to fly out back to Sydney the next day. And it was so hard because it was lost to follow up. I kind of sent the hospital the details. I sent them my clinic details in Sydney, but he was like hemiplegic, the nurses are constantly changing, the doctors. So when you're in remote Australia, there's a complete loss of follow-up, and it's such a specialised treatment, and my colleagues were running the hospital and GPs practice. So I feel like, especially patients who are that unwell that they're hospitalised, they don't have social supports, they can't self-advocate, that's one population group I worry about. The second group is patients with mental health, but more specifically pediatric populations. And I think somebody brought up the issue of, do we hold cannabis to a different standard? I think I would view it as there's a far higher threshold to prescribe cannabis than there is for many other medications. That, you know, when you look up AMH and your GPs, you probably see at the top, like, we don't know how this works, right? And that's a common thing for many drugs. But I remember a patient of mine, 14 years old, and I also practice in Double Bay, so it's an interesting contrast between urban and rural general practice. And I remember getting an email from her mum at 9 o'clock saying she tried to throw herself off a bridge near their house. So this girl's been suicidal probably from about age 10. She's on 2 antipsychotics, an SSRI, several other things, and smokes a lot of THC herself, which her parent then had to acquire for her. I tried to speak, you know, so she was admitted to an adult emergency. She went to an emergency department that did not have a psych specific unit, then was held there overnight, transferred to a hospital with a psychiatry unit, admitted to the adult inpatient psychiatry unit, which I remember going to as a 20-year-old medical student, and it's quite confronting if you're, 14, and then finally getting transferred out. But despite her trying to end her life 6 times, being on multiple agents, like 200, milligrams of Seroquel, there was no flexibility in the discussions in hospital about, can we just weigh up the risk of harm here? We know she uses THC. She self-reports that she improves, but no one's willing to prescribe. And I think it was interesting, I think Dr. Banerjee made the point about applying to the through the TGA for some of his adolescent patients and getting the feedback that you need a pediatrician involved. And as a GP, and I think all the GPs in the room will agree, it's especially post-COVID, having pediatricians and psychiatrists involved in mental health care for patients is very difficult. And I'll say one more experience for when I was in Broken Hill, when I had a suicidal 8-year-old girl who was sexually assaulted, lay down on the road, tried to get run over by a car. Now, when you're a remote GP, I also had the SES in that night trying to cut a steel ring off a guy whose finger was going to fall off. I had a baby being first aided by his dad in the sink who was flying out to Concord, and then you're dealing with this. So I called the pediatrician who said, I don't admit mental health. I called the psychiatrist who said, I don't admit children, and I'm running that chaos, right? And Anyway, but that's not so much about THC. That's about a population group who's really struggling, and we don't actually have anyone to refer them to. And they really, I think the delay to pediatric populations getting some sort of cannabinoid-based therapies is far, unless we kind of all come together on that. And I think the final group of patients is patients with bipolar disorder. So I see a lot of patients who have melancholic depression. They say 30% of resistant depression is actually bipolar 2, right? So they have this really, and the 10 people who end their life every day, I'd wonder what proportion of them actually have bipolar disorder. So there's a group of patients, these people, they typically heavily have self-prescribed and self-medicated with THC. Then they come to see me, and they're getting immense benefit for their depression, so they're able to lift and get out of bed. But then when you assess them and they're assessed to have bipolar disorder, it's a relative kind of contraindication, and there's such a dearth of evidence in the field about what you do. And I have no psychiatry colleagues where I could be like, hey, can we just have a really good support system? This patient's functional. Can we prescribe them, you know, something together and have that kind of oversight? So I think those are really the 3 patient groups that I worry about.
Yeah. Are you finding that the psychiatric community has embraced medicinal cannabis, or is generally, are you finding that the psychiatrist community, psychiatrists generally, are they embracing medicinal cannabis, or are they opposed to it or indifferent?
I think the thing is that people don't realize that post-COVID, we are absolutely struggling. And I'm seeing that we think suicide numbers are 1, but there's so much suffering, especially in young adolescents, that I don't know how hard it is for them, right? Because I'm seeing patients who are still functional. They're seeing just overloaded, like the example I gave you of that young patient, right? So they're just stuck in hospital medicine, right? And this is the problem is like translational research, is that what it's called? But like there's a huge gap between, in hospitals we practice really eminence-based medicine, right? And because you're overloaded, you're working reactively, there's no place for innovation. I really see that innovation is going to happen with GPs who are going to move this forward and are going to be like physician scientists, right?
Yeah, and then that's about education, and we've talked a lot in the past couple of days around ensuring that GPs are equipped to be comfortable to prescribe medicinal cannabis and understand the types of products that are suitable for particular conditions. I might just go back to Lene. Lene, your journey has also included finding the right product for Lindsay. Can you talk a bit about that?
I think that's been a journey in itself. So one of the things that we found when we were in the US, completely different model to Australia. So if you can imagine, if Lindsay was to run out of medicine, we could literally jump in a car, we could drive to one of any number of dispensaries nearby, we could have a conversation with the staff, be able to look at what products they have, and with the guidance of the doctor who had already given us recommendations on what he needed, we could actually source those products, and we could source them very quickly. He also was able to access compassionately supplied products in the US. So there were compassionate programs for patients such as him that may have cancer or need high doses of medicine, but the cost is very prohibitive. What we found when we went up to Washington State was he was able to trial CBD products, he was able to trial THC, he was able to trial THCA. For those of you who are unaware of what THCA is, it's the acid form without the psychoactivity, so it's before it's heated. And so it was an interesting journey because we were able to find which products were working better for him. And then it gets down to strains. And strains can be a bit interesting because you can have one strain grown by one company and it's completely different to another. And thinking about Canada, one trip to Canada, I'll never forget us landing in Vancouver, and he picked up his first lot of medicine and he trialled a new strain that he hadn't trialled before from one of the companies in Canada. And he said to me, Mum, I have never had this much mental clarity. I have never been able to speak as easily as this. And a left temporal lobe tumour affects speech. It affects the ability to understand people sometimes. He struggles with word finding, with putting sentences together sometimes, especially when he's under stress. He can be quite communicative. Lindsay's preferring not to talk right now, but I'm sure he'd probably love to say something. But maybe you can tell them about how that strain was for you.
I'm a pretty quiet person.
You want to talk about it? No. So, I mean, I guess from a parent's perspective and caring for him, it was just wonderful to see this discovery of strains. And so he would vaporise that strain. Now, what we actually found later on was that particular strain would help him come out of focal seizures. So he could go into a focal seizure where he would completely lose his speech. He would completely lose the ability to understand people. So he has two different types of, well, he has a number of different seizures. He has very rare seizures, including spitting seizures and laughing seizures. But he can have seizures where he can understand people, but he can't communicate, or he cannot communicate and cannot understand people. So this strain would actually bring him out of these focal seizures. The difficulty is you can't replicate the same strain across multiple companies because they all have different growing conditions. So it could be just one tiny thing in that. And I think one of the most frustrating things about the Australian model is it is very difficult to switch between medicines and to switch between, to trial new strains. It's not easy for the doctors. We feel for the doctors. And it's not at all easy for the patients. So I guess we saw it from a completely different angle in 3 different countries. And he was able to have that journey of discovery, but it's a lot harder here. Yeah. And we hope it will get a lot easier.
Thanks, Lene. A great story. And I might just ask Vay as well, it's just amazing that you are now cancer-free, and congratulations on the amazing response you've had. I wonder if you have any thoughts about, I didn't quite understand whether your ability to beat cancer was due to other treatments or whether you attribute it to just taking cannabis. What do you think is the reason why you're cancer-free today?
Look, I'm not an anti-prescription medication kind of a guy, but at the same time, during that whole process when I was doing chemo and radiation back in 2019, I was just in a cloud, and the breakthrough pain that was coming through was just really tough. Cannabis was suggested to me when I first was diagnosed, and I did try smoking it, but all it did was just, it got me high, but I was still in a lot of pain. So straight away, that was a fail. A few months later, when I finally did discover CBD oil by chance, again, it was trial and error. And at the time, my boy's mother, we just tried it a little bit, and it was a matter of seeing if we get the right dose. And we ended up getting the right dose, which is about 8 drops. And again, with the different strains that you're saying, we were fortunate enough, and again, the scientist had said it earlier, with the amount of different strains that there are, we did strike, we had a bit of a win in that sense of finding the CBD oil that did work for me. And I was able to, pretty much stop taking all the opiates straight away, and just using the CBD oil without any kind of withdrawal symptoms at all. So, in my personal story, it worked for me, and it's one of those things where I wanted to be able to try and share it in that way.
And it sounds like a combination of conventional treatment and also CBD oil to manage symptoms quite effectively. A great story. Look, I'm sorry, my time's been shortened because Lucy wants to stick to time because the room has to be prepared for the gala dinner. So I'm going to have to stop it there. But if you could all join me in thanking Lene and Lindsay, Vay and Zani for excellent stories.